Hello everyone, welcome to the video on a quick review on anti-hypertensive drugs. Now to treat hypertension there are so many classes of drugs are there. I will simplify them into three classes. All the drugs will come into these three classes. Class 1 diuretics, class 2 sympatholytic agents, class 3 vasodilators. Now in class 1 diuretics the most widely used classes are three classes are there. 1 thiazide diuretics, 2 loop diuretics, 3 potassium sparing diuretics. Now next one, sympatholytic drugs. You have alpha blockers are there, beta blockers are there, centrally acting alpha blockers are there, alpha and beta blockers are there, and then adrenergic ganglionic blockers are there. Now third class, vasodilators. Now in this vasodilators, calcium channel blockers, ACE inhibitors, angiotensin receptor blockers, arterial vasodilators and arterial and venous vasodilators are there. Now understand this one. By blocking calcium causes vasoconstriction. If you block calcium, it causes vasodilation. So they are considered as vasodilators. ACE inhibitors, angiotensin converting enzyme inhibitors, reduce the release of angiotensin 2. Angiotensin causes vasoconstriction. When its levels are reduced, it causes vasodilation. Hence, all these are considered as vasodilators. Now, leaving this classification, clinically there are three important classes out there. They are known as first line drugs to treat hypertension. 3 to 4 classes are there. I will explain them one by one. Now, first class is diuretics. The prototype drug is hydrochlorothiazide. Now, the reason why diuretics are widely used is they are inexpensive and in low doses they have very few side effects are there. When the dose is increased, they will cause potassium depletion, reduced glucose tolerance and ventricular ectopic beats. And thiazide should be avoided in gout. Understand this one. For every class, you need to understand what is the major therapeutic use and what are the major adverse effects are. So after thiazides, the next clinically important class is beta blockers. The prototype drug is atenolol. Now beta blockers are widely used to treat angina as well as myocardial infarction. So this is the major use. Now the problem with beta blockers is they should be avoided in patients with asthma, chronic obstructive pulmonary disorder and then heart block. In all these conditions, beta blockers should be avoided. Now, after these two, the next class is ACE inhibitors. The prototype drug is enalapril. Now, ACE inhibitors are widely used to treat heart failure, diabetic nephropathy, and ventricular dysregulation also. But they should be avoided when people has got renovascular disease, and they should be avoided in pregnant women also. Now, the major problem with ACE inhibitors is they cause persistent cough. Now, these three are the first line drugs. Now, in certain cases, calcium channel blockers are used in elderly people. Only in that particular condition, in elderly people, it is used. Again, nifedipine. When nifedipine is used, it is short-acting calcium channel blocker. It may cause reflex tachycardia. It will worsen hypertension. Now, leaving these things, there are important drug of choices for certain conditions are there. Like when there is an hypertensive emergency, very high hypertension is there, it is treated by intravenous sodium nitroprusside. Remember this one. Second one, hypertension in pregnancy. You cannot use every drug to treat a pregnant woman because it may affect the fetal growth. So only methyl-dopa is preferred one. Next one, to treat preeclampsia. Preeclampsia is a condition especially seen in pregnant women. When pregnant woman has got long-term hypertension, it may cause convulsions. To treat that condition is called as preeclampsia. This is treated by using hydralazine drug. Now, to prevent preeclampsia and convulsions, magnesium sulfate is used. So, these are all the drug classes to treat hypertension and drug of choices for certain conditions. Thank you. All the best.